Doctor, talk about the flu shot a little bit. It's being pressed that everybody needs to get it, young or old, sick or healthy. Is it something that we really need, and is there any proven benefit to that?
The flu shot, Scott, is very effective for the segment of the population that really doesn't need it. And that's the issue around it. We know that flu shots are less effective for young children. The data just came out. It's less effective for the elderly population and for the immune-compromised population. So this is really the population where flu can be deadly. I mean, one of the ideas behind the flu shot, it's part of our culture. We're not allowing ourselves to be sick. We don't have time to be sick. Now, really, if you have a flu, and if you stay in bed for 3 days and have, hot drinks, tea with lemon and some honey, and just take it easy, your flu will almost always go away. But we have to keep on working and going. We don't allow ourselves the off time. So this 24-hour flu is now stretched over many, many, many days because we don't allow ourselves the chance to rest, and there can be some very dangerous complications. So there's a value from this perspective to the thought about using a flu shot. The one issue about epidemiology and prevention and preventative medicine in Western medicine is that it's used based on the lowest socioeconomic layers, which means assuming people want to take care of their health, you want to give them a vaccine. But people who are more conscious, who take more time for a better lifestyle and better diet and exercise and sleep well, they don't belong to this category. And they're actually suffering from this mediocre approach that is addressing people who will not take care of themselves. The real issue with flu shot is that it really doesn't address the population that really needs it. That's its biggest flaw. The other thing that we have to be very careful about giving flu shots to patients who are immune suppressed, cancer patients. And patients also have a tendency for issues like fibromyalgia or chronic fatigue. The flu shots can really aggravate them and throw them into real crisis. And I've seen during my career such patients really devastated their life. So I don't want to say that flu shot doesn't have a place. But having a flu is not the end of the world. In fact, from a holistic perspective, an acute illness with high fever is an opportunity for the body to shed off its toxin, to discharge, to regulate itself in a better way. There's a value to acute illnesses. We know now, for example, that children that don't go to preschool and don't get colds and flus and don't get runny noses have more chronic illnesses, have more asthma, because the immune system hasn't ripened. One of the issues these days, of course, is because of vaccines. Many of us didn't have childhood illnesses anymore. And therefore, our immune system hasn't been properly trained. So if you feel strongly about having a flu shot, I won't say no, But it's really not necessary. I've never had a flu shot, and I don't recommend my patients to have flu shots. But they're taking other benefits. What are the things that you can do instead of a flu shot? The first thing is that we want to take care of our health on an acute basis. If you take care of your health on a long-term basis, you will have less chance of getting a flu, which means proper hydration, enough sleep, regular exercises, healthy diet, and good supplementation. And it's actually doable. It's a good investment. We take care of our cows, we clean our houses. This is our house. This is our shrine, This is our body that carries us, allows us to do what we want in this life. So we need to take care of it. On an acute basis, there are also things that we can do. One of the most effective things for prevention of colds and flus and for shortening is the category of medicinal mushrooms. Medicinal mushrooms are well-known immune enhancers, and they will help you, from my experience, using medicinal mushrooms on an ongoing basis. You just don't get as sick. And I know from my experience, when I don't take them on a regular basis, I pay the price. And very often I'm on the verge of getting a cold or a flu, and I will take very high doses of medicinal mushrooms during the day, and by the evening, I'm fine. So medicinal mushrooms are really high on the list for prevention of flu, and you can take them just when the flu or the cold come. High dosages of zinc are also very important. Echinacea extract on an acute basis is very good. Also, it has some immune enhancing effect. There are multiple botanical formulas that can be of great help. Also, keeping warm. In Chinese medicine, the category of cold is called cold wind, which means we are exposed to wind and cold and we get sick. And I remember from medical school, I was already interested, and I talked to one of the bacteriologists who was giving us a lecture, and he was saying, oh, it's nonsense that when we are outside in the cold and flu and it's cold and windy, we're going to get sick. Because when you look at the viruses and you put them in cold air, they don't get sick. You know, it doesn't affect them. They don't grow faster. The only thing this bacterial professor forgot, and this was, I was just in third year medical school, I was just getting into alternative medicine, but I remembered it many years later. The only thing the person forgot, this virus is inside somebody's body. And the cold, I mean, we all had the experience. We go out to the cold and we get a sore throat. And then if we stay in the cold, we get sick suddenly. Why? Because it changes our body responses. It changes our immunity. It changes our circulation. It changes our vitality. The virus is not an isolated event. It lives inside an ecosystem, inside our body. That's why staying warm is very important. And also, of course, in the flu season, washing your hands very frequently is very important, because that's often how we pass on flus and colds. And colds and flus are very different in their nature. Cold is much more milder. Flu is like hitting a truck. A truck hits you and comes right away. More starts with joint pain and aches, and you really feel sick. But medicinal mushrooms, using minerals like zinc, using different herbs and botanicals like echinacea, different formulas that are especially a lot of them in Chinese medicine, and some homeopathic formula that are very effective. All of this can really help to prevent flus, and if you get flus, and colds, to make them very short-lived. And this has been my experience. My experience with medicinal mushrooms is that years ago, I had to take very high dosage every day to prevent colds and flus. Now I have to take only 1 or 2 capsules a day. But I have to take them. When I forget, I pay the price.